establishing neighborhood planning, formalizing it, and also talked about the need to include health, either through health impact assessments or some other way in the planning process. And I'd like to ask you to sort of elaborate on that and have comments from Daniel and Shai. How can we actually include health more effectively and efficiently and appropriately in the planning process?
Sure. So the good news is that folks from HPD to Department of City Planning to EDC have welcomed us public health folks into their world of planning. So from a staffing perspective, the day-to-day folks who are leading a lot of these zoning conversations are wanting to see the health piece be a part of it. What we have to distinguish, and this is a distinguishing piece, certain neighborhoods, depending who's in the audience, when you bring up health, they'll bring up healthcare access. We're not talking about healthcare access per se. We're speaking about the healthcare access issues are preventable if communities are designed significantly differently. And the cost savings attributed to prevention can be manifested if we start looking at including health impact assessments in the planning process. What needs to happen is agreement that that's something that's going to be looked towards and included. It's really simple. It's not, from us, from a public health standpoint, we want to educate our colleagues in the city, just like we have active design guidelines, and we have other things that have manifested as a result of the educational process from an interagency perspective, about where the cost savings can happen for the city of New York if we have a prevention agenda that is interagency driven. That is the simplicity of what we're looking for to start that conversation. If we can turnkey the processes that the Department of City Planning leads to include health impact assessments, great. That's a great first step. It's not the only first step, but it's a great first step, I think, for us. We right now have people that can do health impact assessments, but the information sits on a filing cabinet. So we want to move that information off of the filing cabinets and have it connected to the neighborhoods that are looking for that information, so that when the act that we talked, I forget who talked about, Daniel talked about this. One of the major things that always I'm concerned about as having the opportunity to work in neighborhoods for a long time is when folks are fighting for their communities, we as public officials have to equip them with the information that we have at our disposal a lot better. So when folks are advocating for looking at the zoning proposals and saying it's not fair, I feel like it's my duty to make sure that they have more talking points. So that way, when the folks who sit on this table and this unfortunate dynamic plays out, that someone says something that when that person is not paying attention to that individual, they look up and say they mentioned health around 15 times. And that's what has to happen. Because right now, we are putting our communities at a disadvantage by being gatekeepers of information. So what I propose to do, and this is something that our commissioner is wanting to do, is sitting down with the various leaders, the various commissioners across the planning agencies, and figuring out how can public health play a stronger role. And that's what's going to be happening in 2016.
And Daniel and Shai, maybe a reaction from the point of view of a development agency and a development company. Does incorporating health in these processes slow down the development process? Can it be incorporated in a way that is productive?
I'll take it, and then you come from the developer perspective. Okay. Actually, a little bit of developer perspective as well from us, because we're financing these projects. And so I brought the green building movement up earlier because I was involved in sort of the early years of USGBC and the enterprise stuff. And what was interesting is we were trying to figure out how we were going to get the market involved in these larger public policy issues. And it wasn't until we were able to monetize the savings to a developer that they became interested. But then there was an increase in construction costs that we had to manage. And it wasn't until there was more market demand from people, that it began to sort of push people, the construction industry to begin changing their methodologies of construction materials, et cetera. So I'm not sure how to monetize the health benefits right now. I think that what we can do is begin instilling and maybe you have an answer, but instilling that high impact, low cost strategies into buildings so that we begin at least influencing the design of buildings with architects and people earlier on, and so then people just become accustomed to these are the ways that buildings get designed, and they have these features in them. And again, low impact, high impact, low cost kinds of things that we want to put in. But on the planning side, you know, we are working closely. We're sort of launching now and practicing how we're going to get health information in front of people. But we think that it's actually safer, more interesting place to start a discussion around the health benefits of housing in their neighborhood, the health benefits of better transportation choices, parks and open space, better sidewalks, sort of the livability and health kind of then become more aligned, and people can talk about that sort of stuff. But I think the more that we, again, like we're making the data available to people, the more equipped they are then to ask for these things in community meetings.
Sure. I guess there's a couple of points. One is that right now there is a children's cabinet with the current administration, which is really, I think, tapping into this need for both intergovernmental collaboration and then the sort of public-private partnerships. And I think having the representatives of the various CDCs and nonprofits are important to be at that table. And you know, if you look at the research, the housing that's kept permanently affordable is almost strictly only that held by community development corporations and nonprofit affordable housing developers. So when we subsidize housing by private developers who then later remove the affordability, it's actually a loss. We're subsidizing a loss. And then the incentive programs like FRESH are helpful, but there need to be more and different kinds, because you can only plan so far by way of the pickup. And we had tenants, grocery tenants, who didn't want to utilize FRESH, and then we had others that did, and there were very distinct financial reasons, and sometimes bureaucratic or reasons or issues of distrust. So those can be addressed with other types of programming so that there's more options. There's also, I think the biggest opportunity for the planning would be to address food from a prenatal to end-of-life way, where it is completely comprehensive, it is completely integrated into everything that is being done in a community, with a real target through schools because of their extended outreach, and working with the businesses, but that, you know, at every moment in someone's life, there is a complete way by which food, nutrition, health, and wellness is related to them. And then I think the other two ways to address the planning would be, one, through the addressing the acquisition prices, because you know, right now as a result of the rezoning, it's spurred incredible speculation in the real estate market, and it's now $157 per square foot acquisition cost. HPD will give you between $20 and $30 per square foot. So it's not affordable right now to purchase properties, and there has to be ways to address that. Otherwise, our options to be able to build and subsidize you know, fresh food outlets will be harder, but then it requires us being more innovative, like with farmers markets and things that aren't related to a real estate development. They may still have land, community gardens, for example, and so forth. Yes. Not every site needs to be housing. There are many different types of ways to utilize small plots of land. And then finally, I would say, to your point, research, that the community should be doing its own research as well, and it'll be in a better position to then advocate and work with the city so that we can see what the discrepancies are between the data.
Any other reactions, or if not, we'll open it up to the audience. Nick?
So thank you all so much for this. I think it's so exciting that we're coming together to talk about these important questions. The starting point for my question is your observation that it took 7 years to open one small grocery store. I think that's really sad, and I worry about really the asymmetries in power between the people who are making decisions, the developers, and the people in this room and communities. And we've done some work in East Harlem in the last few years. Probably a few $1 billion have been invested in residential and commercial real estate in East Harlem. And for the most part, the people living in East Harlem have had zero voice in making those decisions, zero voice in closing Pathmark and opening Whole Foods, in what kind of housing and the affordability. And very impressed by both the city agencies and Cypress Hills and other organizations doing the incremental work that, of course, we need to do. But I wonder if each of you could say something about how you think about the long run, and what's the transformative strategy that will change the power dynamics between developers, city government, and communities that will allow a different kind of voice in making decisions about food and health. And we need to do both, but I'm interested in hearing your thoughts about on the transformative side.
I'll take a first shot and then see how it lands. So many of my colleagues and I, every day we say that community boards need to be reconstituted and the power dynamics need to change. Community boards can be a mechanism of change if certain things were to evolve over time. The fact that there are legislators out there that I know that want to continue to devalue what community boards have the opportunity to weigh in on is problematic. City agencies should not be the end-all be-all voice for community planning in the context. So the long game to answer is, I do believe that there is a mechanism to safeguard and protect against everything you just described, Nick. I'm not saying it's only community boards, but community boards need to have a way that there's a diverse group of people who sit on those community boards, and they have the power dynamics to stop things from happening, and have a level of accountability that I think a lot of the activists and advocates are looking for someone in their community to be accountable to them, and vice versa. I don't think that exists right now. People don't know who to hold accountable, and they look to us, and then they'll say to us, well, you guys aren't elected. We elected so-and-so, but so-and-so's not in the room, and we're there presenting our data and our proposals. So the accountability structure has to change, especially in black and brown communities where they feel disempowered more often than not.
The community boards are advisory,
Right.
and there have been people who said they should be elected, which immediately they have unequal populations. They bring up the issue of one person, one vote.
Right.
So this structure is not a way that you could have a pure democratic input over there.
Agreed. No, I agree with you. I'm not saying that it is currently constituted as such, but I think if you look at the mechanisms within the city of New York, that's a mechanism that if you rethink it and redevelop it to what it could be, talking long game, it could play a stronger role and a more accountable role for the residents in their neighborhoods in ways that they currently are not.
Daniel Rashad, do you want to respond?
Sure. So when I first started this office last year in September, there had been one meeting with the Ford Foundation before I got there, and I had friends at the Ford Foundation. I decided to pick up that discussion, and the discussion is that there was we knew that we were going to go out and start this neighborhood planning efforts in the rezoning areas, but who were we going to engage with and how? And so that's how this neighborhood planning book came about. But when I met with the commissioners, and having come from a community organizing and community development background, they were talking about, well, we got to help facilitate, community organizing and community development. And there was a moment where I thought that in order for us to we had to organize and understand how to do that as a city agency, so I kept on using this metaphor. I got made fun of because I was doing this top-down, bottom-up sort of thing, but there was, that we had to be able to be good interagency collaborators ourselves in order to understand how we would work effectively among ourselves to bring the resources that we have available to us. And that we can't organize communities. Communities need to do that, but by sending the message to them that we want to work with them and we're coming your way, it allows them to then organize and have time to do that so that they can, organize their efforts. And as we heard, they also need resources to do that. So the discussion was to Ford Foundation is give us some money to help us figure out how to be good interagency collaborators, but develop a long-term strategy so that there is funding available to community development corporations on the ground to build the groundswell that we want to see as a city. I think this happens very rarely in a mayoral administration, and this administration was committed to that. So now the Ford Foundation with other foundations came together to create a collaboration. And they now have a staff person that's working on doing grants with CDCs around the neighborhoods, particularly in these rezoning areas, to help them organize. Having come from the West Coast of San Francisco, seeing organizing happen over a period of time, I think that we're creating the groundswell right now, and I don't think that the tide can turn back very easily. And when we're entering into neighborhoods right now, they are incredibly sophisticated people on the ground. So I don't think the city can change either. So the groundswell is developing. The city agencies are going to have to deal with it. So I feel like we've set something in motion right now, and we'll see where it lands in 5-10 years from now. But I feel good about this administration having, affirmatively said that this is what we want to do. But also, as we heard, it can be chaotic, and it's incredibly messy. And the comfort for me is that this is year one, and we're getting hit hard. And I think we're learning lessons as agencies, hopefully, that will begin to kind of build on lessons learned as we move forward. And I think the communities are experiencing the same thing. The reason I bring up this thing about advocates and negotiators versus problem solvers with this is they're also not used to the city agencies like opening up and saying, we're here to work with you. There's this us-them still strategy that we have to continue to break down over a period of time.
I'm going to try to articulate what I think is a larger issue that you're pointing out, and I actually think that these two responses are really significant. And so I think you're asking a question about capitalism. And it's a good question. And we're talking about these issues of food, and we started off talking about issues of inequity. And right now, it is mostly low-income people of color who are disproportionately affected by the lack of access to food and the other issues related to nutrition and deficiency in that realm. And so that, combined with the fact that there is basically a wholesale displacement of people of color through gentrification in innumerable New York City neighborhoods, those are the same two forces. So we can't address one without addressing the other. And those are also the same forces that are sort of underneath all of this in regards to big agro, like why it's so easy to get a Snickers bar, right? So I think my answer to that question is that every single person has a voice, and all of us, no matter what our fields are, really do need to be voicing that there should be concerted effort and commitment to address these systemic root issues, because if we don't address them, all these other things are just dealing with symptoms. So I know that that's easier said than done. I was once at a few months ago at an affordable housing conference where there was a congressman talking about terrorism at an affordable housing conference. And people, and I've been to many, many affordable housing conferences over the years, were sort of taken aback by this. But his point was that HUD will fund more affordable housing if it stops going into communities where it knows nothing about and destroying people's lives, both abroad and at home. So I would say sort of the same thing. In order for us to address food and these other issues we're talking about, we do have to address how everything is funded and the structure that that money flows.
Okay. Thank you. Well, let's open it up to the audience.
Yes, my name is Arish Javadi. I work with More Gardens and New York City Community Garden Coalition. And it's so exciting, and thank you again, Evan, for bringing such a great group together. To hear that from city agency, having been kind of arrested in many of those 15 zones defending community gardens, it's really great to know that that's shifted and that opening is happening. And again, I thank really the community gardeners on the earth from the last 40, 50 years where they've been doing that, the actual community development for that last 50 years. They said, we don't have food, there's not fresh food around here, we want to grow that food ourselves, and went and took the land that was just rubble and created that. So from that, I just want to say, at this point, and we've invited in our last forum the city agencies, and the mayor said that we will actively work with housing and create spaces where those community gardens that exist at the moment, and many of them are endangered right now. We're fighting, we're going actually to Brooklyn after this to defend gardens that are being developed on at this moment. And there hasn't been a shift that I've seen as yet where there's a real front focus that says those community gardens are to be preserved, and we're going to create more green spaces with the new housing, really actively and creatively. So there is an integration between gardens, and I just want to see how is that happening, and where do you guys see that
I
going?
want to make a quick answer to that, because I didn't get an opportunity to talk extensively about the project, but that is an element of the Pick and Berryman development. So in the rear of the project, there's a community garden, and there's one for the public with a little bit of a playground, and then there's one just for the tenants so that they definitively will get beds. So that is an element that we were very excited to include.
Thank you. I just to your back.
I just want to say that we, in our agency, well, in our division, it's taken some folks a long time to buy into urban agriculture in terms of scalability and impact. There's been a systemic shift with our new commissioner and everybody to rethink it, and I think how we can be helpful, more helpful, is to look at, to work with you and think about the impact that you're having in the community, what scalability is within the context of the community garden movement. We can do a better job of working, and we look forward to possibly partnering and figuring out what true analysis looks like and how we can be helpful.
Fern, you have your hand up?
Yeah, a couple of items actually. In the dialogue, Ferndale Estro, FTE Food and Nutrition Team, dietitian, I'd like to bring attention to the need to engage families in this dialogue. And one of the issues, of course, about engaging families is time. We are supposed to be supporting breastfeeding, and I know that may seem a strange conversation in this dialogue, but I never see that piece of the plan built into any of our gardens, any of our facilities, our buildings, that support system. It's vital. Not every person in the community is comfortable breastfeeding with a blanket over their shoulder. Pumps are a huge issue because of access. So I ask you as planning people to start incorporating that, but even at the garden level, there's a place for that, because by a family being able to be at the garden to do these things makes a huge difference. In terms of the gardens, what is the urban plan, what is the planning for rooftop? Because to me, it seems that you can't, one, if you're doing the building, it makes sense. Why is it, I don't see it incorporated sufficiently. And that's an access issue also for families, because sometimes it's hard to get away. And two, that is a huge zoning issue currently, because there are buildings in this city, if we could make this, shift the zoning, that's a zoning problem.
Please, I'd like to ask the audience, please be succinct in your questions, so we have time for, issues like breastfeeding and incorporating that into design and development and gardens. Can you respond to that?
So there's a wonderful initiative called Baby Friendly Hospitals.
Not familiar with it,
right?
thank you.
So I think The advocacy could be, just like we have active design guidelines, you know, there could be room to take that form of baby-friendly hospitals and see how it could be a part of future housing initiatives in some way, designating space.
There is actually something called baby-friendly
Baby
communities
right.
out of your.
So I think
Canada.
there's room to continue that conversation, yeah.
Nevin, why don't you answer the rooftop garden? I mean, Nevin, most of you may or may not know, did the 5-borough farm thing, so you're probably the big expert in the room on that.
Well, I think just,
Sorry, Ellen.
distinctly, I probably want to hear from the city on that, but there are zoning incentives actually to allow for rooftop farms on city buildings, and there are 3,000 acres of flat rooftops in the city that could be farmed. And so the challenge, I think, is to develop a plan to exploit that and to find the financing and other mechanisms to enable gardeners to be able to afford to actually install gardens on rooftops. So there's lots of exciting-
It's a complicated issue in terms of the financing for development. We did make a proposal for a very large project. We did not win the RFP, but it did include a community garden on the rooftop, and we were able to do that because of the scale. So it wasn't a smaller project, it was a larger one. We've also done greenhouses, and we included greenhouses with the school. We built a school, PS 89. So it is something that is on the radar, and I think people would do it more if there were more incentives to decrease the cost.
And a few years ago, the city planning department adopted green zone zoning code changes that allow for greenhouses to exceed the height limit of buildings and to not count those structures in the FAR, the floor area ratio of the building. Okay. Yes.
Yes, I'm Susan Sandler, I'm a registered dietitian. I sometimes work in East Harlem, and my question is about monetizing health benefits. What hard data are there that show that improvement in health will reduce taxes for health care and redistribute it to be able to be redistributed to education and all of the other services that improve quality of life?
Well, that's tough. Data, so to not bore folks, but to highlight what's happening that hopefully will prove that. So the CMS, the Center for Medicaid Services, has allowed the state of New York a windfall of over $9 billion to health systems across the state to have a prevention agenda where they will look at certain indicators, and basically it's preventing hospitalizations. So by having a prevention agenda, and prevention agenda encompasses a lot of the work that you lead, there's going to be cost savings. Now, to your point, and this is something that hasn't been tested, the redistribution of those savings, as it relates to Medicaid dollars, is something that needs to be proven. So over the course of the next 5 years, depending on how the health system responds to the prevention dollars that have come out, then you can ask a question to the state health department, okay, you've saved a lot of money, Medicaid rolls have decreased, less hospitalizations, how is the money, how the tax dollars being redistributed? And there's no data and there's no study to say that it's theorizing at this point right now, so we have to wait and see, more or less.
So this will be coming down the pipe. It
This
does not yet exist.
No, it does not exist because the hospitals have to meet those certain standards. So they won't get the windfall of dollars for prevention unless they hit those standards. If they hit those standards, you compare the money that they receive for prevention versus the cost savings of hospitalizations, then you can start making an analysis of like how do you redistribute those tax dollars. You won't know that right away.
Yes.
Hi, my name is Andrea Hill, and I work for the Bank of New York City. And I have a couple of questions. One is, did you use the meal gap data for these community health profiles?
I'm not, my epidemiologists are not here, but I can follow up and find it. Yeah, I can follow up on the meal gap.
Be able to get access
Yeah.
to those profiles?
Sure.
And just a comment on a consideration of what might be a good way to integrate the needs of the community with these supermarkets is to have some of that space available for emergency food. Because what we found is a lot of our agencies, we have over 1,000 community partners, they come to us wanting to do this work, emergency food access. But in some neighborhoods, they don't have the churches and synagogues and community centers to actually be able to support that. So we have these areas that the meal gap is really high and the access to emergency food is really low. And if there's a way to really be mindful of that, because that is not going to change, just like capitalism is not gonna change real soon. And that we should be mindful and not just leave it to whatever church can do this work, but that we take an active role in saying when we're handling these, we're looking at these communities in development, that the supermarket is good, but there is a need for emergency food as well. And people are not gonna just get emergency food, they're also gonna shop. And